The following portion of Daytime is sponsored by the Jasin Facial Rejuvenation Institute. Well, you've made the decision to have a cosmetic procedure to improve your appearance. Now what? The best way to ensure the results you want is to do your homework. Here to talk about that is the face doctor, Michael Jasin. He's an authority on facial plastic surgery, and he's brought along patient Mark Wallace. Hi, gentlemen. Good to have you here.
Good morning.
Dr. Jasin, finding the doctor. How do we do that, first of all?
Well, you want to maybe see about referrals from friends and family and who's had surgery with that office. When you call the office, you'll get a pretty good clue on the first phone call what you're dealing with. You want to find out if the person on the other end of the phone can answer your questions. Are they courteous? You know, if you call in about a neck lift and they've got to turn to Sally next door to go, do we do those? That means they probably don't do a whole lot of neck lifts. So that's not the one place you want to go for a neck lift.
So certain questions I should definitely ask.
Yes, you want to make sure you get your questions answered to your satisfaction with that initial phone call to make sure they're knowledgeable about the practice and procedures that you have interest in.
And ask about accreditation?
Oh, absolutely. That's a big safety feature. Office-based facilities for surgery should be accredited by a regulatory body that's recognized as an accreditation agency. So that's very important. You want to know if they have a crash cart in the event of an emergency. Are the doctor and the staff trained in advanced cardiac life support? What's the emergency process to get you to the hospital? Those sorts of things. Above that, you want to, if you meet with a staff member first before the doctor, you want to see if they're familiar with the procedures that you have interest in. You want to find out if they know about the doctor's credentials, how many procedures he or she have done, and what's their success rate and what's their satisfaction rate. All those things should come into play. And then, of course, you need to have adequate time with the physician themselves, because they're the ones that are going to do your surgery, and spending time just with the consultant doesn't get you that bond with the physician.
Ask about anesthesia too, right?
Anesthesia is another important factor. You want to have a choice, hopefully. Well, can you have sedation if you want sedation, or is it just under local anesthesia? Are you going to be monitored during the procedure? Those are all very important questions. Ask to see the operating room when you get there.
Well, let's say I've chosen you. We've had our consultation. I want to have a clue about what my results could be. You can provide that.
Yes, many times I will do computer imaging with our patients during consultation, so I can demonstrate for them what we potentially may be able to accomplish with surgery. It's a very nice communication tool and allows us to get on the same page with the patient. And actually, we're starting to ramp up a newer technology using DimDim or Skype, where we can actually do internet consultations in a live conversation versus just keying back and forth and sending photographs.
That's great.
We can be looking at the same image and actually talking back and forth.
Well, let's give an example of what it is that you provide. There's your patient. Far left is how she started out, right?
Correct. On the left is the preoperative image before any surgery. The middle photograph is what we imaged for her on the computer, and on the right was her postoperative result.
Very close to what you predicted, huh?
It really is, and we find it to be an excellent communication tool.
And that was a simplicity lift?
Simplicity lift and neck lift, a little bit of filler.
Nice. Okay, let's take a look at our next patient.
And this patient's a good example of how we can discern between one procedure and another. She was torn between a neck lift and a simplicity lift. For various reasons we couldn't do both, so we had to do one or the other. And this helped us opt for the simplicity lift, which you see on the right-hand side is her post-op result. In the middle is what we imaged for her on the computer and helped her make her decision.
Nice. Well done. And there's Mark.
This is our patient today, Mark, who came in, and there he was on the left during the consultation. The center photograph is what we imaged for him on the computer. On the right, again, is his post-op result.
All right, Mark, I have to ask you now, what was it that made you seek out Dr. Jasin?
Well, it wasn't a decision that I made overnight, so I did a lot of research into what I wanted to have done and how I could have it done, and talked to other surgeons, as a matter of fact.
What were your concerns?
My concerns was downtime. Like anyone else, I have to continue on with my profession. I also was very concerned about the staff and the type of doctor I was dealing with, and I was very, very knowledgeable once I left his facility that I was with a doctor on the cutting edge.
And what were you having issues with?
Well, I had what I called a chicken neck.
Oh dear,
and
a lot of people have that.
And then I had what little basset-hound ears down here, so I really couldn't do anything about my face. I like to maintain my body in a good sense without some type of plastic surgery or cosmetic surgery, so we wouldn't get it done.
Well, you look fantastic.
Thank you.
And it worked. Mark Wallace, thank you, and Dr. Michael Jasin of the Jasin Facial Rejuvenation Institute. Hey, to get your questions answered or to schedule a consultation with Dr. Jasin, call 813-975-3223 or log on to jasonfacial.com. Don't go away. Daytime. We'll be right back.